Today, we're going to dive into a really challenging and honestly, a very different way of looking at fibromyalgia. That condition defined by its chronic, widespread pain? Well, what if the way we've been thinking about it is all wrong? Let's get into it. So let's start with this one big question, because it really sets the stage for everything else. What if all that pain isn't actually the disease? What if it's just a signal, an alarm bell going off, trying to tell us that something much deeper is wrong? Just keep that idea in your back pocket as we go.
For so many people with this diagnosis, the experience is just incredibly frustrating. You're in real, sometimes debilitating pain, but you go to the doctor, they run the tests, and everything comes back normal.
They're all symptoms pointing back to one single massive underlying problem.
Okay, so if it's not really a pain disorder, then what is it? Let's unpack this alternative way of thinking about it.
Remember that autopilot system we just mentioned? The autonomic nervous system, the ANS? This is the thing that controls everything you don't think about. Your heart rate, your digestion, your blood flow. This new theory says the root of the problem isn't in your muscles or your brain's pain centers. It's right here, in a malfunctioning autopilot.
So let's put these two ideas right next to each other. On one side, you have the conventional view. It's a pain disorder caused by a brain that's become hypersensitive to pain signals. On the other side, you have this new perspective. It's actually a circulatory disorder.
So the goal here is completely different. The conventional medication approach is sort of like snipping the wire to your car's check engine light. Sure, the annoying line is off, but you haven't fixed the engine. This alternative approach is all about actually lifting the hood and fixing the engine itself, restoring the body's fundamental systems.
So let's zoom out for a second and just think about what it means to look at this condition through this brand new lens.
Really, the big takeaway here is that fibromyalgia might not be the disease at all. It might just be the loudest symptom, the screaming alarm clock that's trying to wake us up to the fact that the entire factory, the body's whole system of regulation and circulation, is on the fritz. But in this new view, they're all just treating different branches of the exact same tree, without ever getting to the root of the problem.
So we'll leave you with this final thought. This whole perspective on fibromyalgia really pushes us to ask a much bigger question about chronic illness in general. Are we just getting really good at putting neat labels on different collections of symptoms, or are we actually doing the hard work of digging deep to find and treat the real root causes? It's definitely something to think about.